The Russian Federation is experiencing one of the most rapid growths of HIV/AIDS infections in the world, and most infections are due to the sharing of needles and syringes among injecting drug users. These infections are easily prevented in other countries, using cheap and effective programs such as the provision of sterile needles and the substitution of street heroin with medications like methadone. However, Russia ignores scientific evidence and still refuses to adopt these harm reduction programs. At the 53rd session of the Commission on Narcotic Drugs of the United Nations, the HCOU's video advocacy team attended the press conference of the Russian delegation to ask why.
In the European Union, they have methadone prescription programs. Does the Russian government think that maybe introducing this kind of programs can decrease the demand of drugs in Russia?
Что касается второго вопроса по заместительной терапии, так называемой, в большей части говорят, метадоновой терапии, то могу сказать, что в России поддерживается консолидированное мнение многих специалистов, и наркологов, и органов здравоохранения, наших научных специалистов против этого. Кроме того, научно доказанных клинических испытаний, подтверждающих полезность этого метода, пока наука мировая не располагает. В этом вопросе мы солидарны с нашими коллегами из Соединенных Штатов Америки, они имеют такую же позицию. Хотя мы не препятствуем каким-то экспериментам с метадоновой терапией в наших регионах, мы не запрещаем, но и не даем, так сказать, федеральной поддержки.
Yesterday, Mr. Ivanov from the Federal Drug Control Agency said that there is no evidence that methadone substitution treatment works. And I ask again, is there any way how you and ODC can engage in a dialogue with Russian government to change that position?
Regarding Russia, yes, I did attend myself the session, the meeting with the press by the drug czar of Russia, Mr. Ivanov. Yes, he did. He made a statement about substitution therapy and methadone as not being successful. We all are entitled to our views. That was he said. I would have not said that. But I also recall, and I pay tribute to him, that he said that there is no federal legislation in Russia supporting methadone facility, but we allow experimentation going on, allow regional entities, including municipal administration, to engage in substitution therapy. I believe that is something quite positive. What we are left with is to help Russia understand the question. Thank you very much.
Yesterday there was a press conference of the Russian delegation, and Mr. Ivanov from the Federal Drug Control Agency said that there is absolutely no evidence for methadone, that methadone works. Mm-hmm. What is the position of the European Commission on opiate substitution treatment?
The exact opposite of what Mr. Ivanov says on all accounts. And we believe that it's peer-reviewed scientific evidence, and we are using it. We are using methadone treatment all throughout the EU, and we're not going to change that.
Do you see that the EU can have a role in convincing the Russians?
We're trying, and we keep talking to them, and we also know that we have the support of other partners like the US.
I would hope that anybody who's dealing with the Russian government is giving them much better advice than they get now from their specialists. Anybody who speaks, Mr. Ivanov or anybody else who says that this is not an evidence-based intervention is directly scientifically wrong.
Более того, применение метадоновой терапии на Украине, в Беларуси и в прибалтийских республиках за время применения мы видим такое ухудшение наркоситуации. То есть оно не дало эффекта, наоборот, отрицательный эффект.
What are your experiences with methadone program in Lithuania? How many programs you have? How successful you think they are?
Substitution treatment was implemented in Lithuania in 1995, so I expect it's quite a long time for results. And the main point is that substitution treatment and below threshold services led us to decrease new HIV cases from 70% 5 years ago to 30%, so it's quite positive results, I think.
I've been working with the Clinton Foundation in Ukraine since the advent of methadone in the country, particularly in the oblast of Dnipropetrovsk. It has worked out very well. There are now over 500 patients in the oblast on methadone. They need many more in order to impact the huge drug problem that they're having there now. But the patients are extremely happy with it. It's just phenomenal to see the changes in their lives.
Зато мы располагаем медицинскими данными, подтверждающими, что если героиновая интоксикация снимается за 2 недели, то метадоновая интоксикация, на снятие метадоновой интоксикации уходит 40 суток.
Well, many countries start with narcotic clinics, detoxifying patients, and hoping to support them after they have stopped taking heroin. In fact, we've seen from so many studies that this not only doesn't work, but for those that relapse, and there will be many, everyone as a basic human right needs access to the medication that will save their lives, prevent infection, prevent overdose.
I have a question to Mr. Siddiqui. If you could clarify for us whether we can consider the restriction of access to sterile needles and the denial of methadone treatment to drug users a human rights violation. If you could talk about this.
For me, and not giving the right of the people to have access to services when those services can save life, it is a violation of human rights. And I'm just saying that like that.
Alan here from the Harm Reduction Communication in New York. When a country like Burma violates human rights, they're internationally isolated. When Russia comes to meetings like this and denies the science behind methadone and needle exchange and publicly refutes the science that we all believe in, not a word is said. And yet they're denying access to all these medications, to methadone, to sterile syringes, and there's no response. What can we do as an international community to actually put pressure on the Russians?
The IS doesn't really have an opportunity to put any formal pressure other than bringing the evidence and making the evidence known and basically highlight the gaps that are present.
Russia has the largest epidemic in the region with 1 million people infected with HIV, and we are deeply concerned by the non-availability of opioid substitution therapy and the fact that the vast majority of needle and syringe programs are being supported by external donations.
We personally believe that when scientific evidence is there, it needs to be used and used to reduce certainly suffering.
We count on all of you, the press, to make this a priority and to highlight the areas of deficiency that we're here outlining for you.